Hi, it's Lusandi. Previously, Dineo got exciting news that she has a donor for her transplant. Now, let's go see her transplant journey. Sipiwe decided to register as a donor when he read about Dineo's story on the internet. He needed to take further blood tests. They confirmed that he's a full match. He is so excited, but his family is concerned that the process will be harmful to him. He has already spoken to the doctors as well as the DKMS case manager about what would be expected of him. And now he'll explain it to his family. First, he will be examined by a doctor to see if he's healthy enough to be a donor. He will also need an X-ray of his chest, an ultrasound of his stomach, and a special test for his heart called an ECG. Once the doctor is happy with his general health, he will have some blood tests done to make sure that he has no underlying infections. As soon as the results are back and all is normal, he will get what is called a final donor clearance. For the actual donation process, Sipiwe will get a small injection for 3 to 5 days before he donates. This injection increases the number of stem cells in the bone marrow and causes the stem cells to leave the bone marrow into his veins. Because he doesn't need so many stem cells, he can then donate them. On the day of the donation, Sipiwe will go into hospital where a needle will be put into a vein. He will then be attached to a special machine that will filter out all the stem cells from his blood and give him back all the other cells. The stem cells will go into a special bag attached to the machine. When enough cells have been collected, the bag is frozen and kept for the day of transplant. In some cases, it may be necessary for the person donating to go to the operating room or theatre where the stem cells are taken out of the bone marrow directly. But not to worry. The person donating will be sleeping and won't feel anything. For Dineo, however, this won't be necessary. Sipiwe will be able to continue with his life immediately and may only feel a little uncomfortable for a day or two. Sipiwe is a little nervous that his cells will not save Dineo, but he's sure he must at least try because this is her only hope to get better. For Dineo's process, she will be moved to the transplant section of the ward where there are isolation beds. This means that she will have her own room and her own bathroom and will not be able to go out of the room for a few weeks. Tomorrow, she'll have a special venous line put into her chest. This line is almost the same as a port. It is put in to make sure Dineo has no infections in her lines before the transplant. Approximately 1 week before the transplant, she will start receiving chemotherapy. This chemo will kill off her own bone marrow cells, including any cancer cells that may be left, all to make room for the new stem cells from Sipiwe. Even though it is called a transplant, Dineo is not having an operation. There's no drilling into her bones at all. It's actually more like getting a blood transfusion. The cells from Sipiwe will be given to her into her special line. Once the stem cells go into Dineo's veins, they know exactly where to find the bone marrow and will go and live there. It will be over very quickly, and Dineo is not expected to be uncomfortable at all. It can take a few weeks for Sipiwe's stem cells to grow new blood cells in Dineo's bone marrow. During this time, her blood cell counts will be very low. When her red cells are low, she will need blood transfusions. When her white cells are low, she will be at risk of infection. And when her platelets are low, she will need platelet transfusions to prevent her from bleeding. One of the risks of a transplant is something called GVHD for short, and graft versus host disease. I got it right. In long form. This happens because two people are never completely, exactly, perfectly the same. GVHD happens when the new stem cells enter the sick person's body. It's sort of like when you move into a new room. It doesn't feel like home right away, and sometimes it's scary and uncomfortable. This is the time the new stem cells may notice some unwelcome cells and fight against it. You can have a rash or an upset tummy during this time. But over time, as you would make your room your own, so the cells take root and make the new bone marrow their home. The doctors look out for this very carefully and will do everything in their power to prevent it from becoming serious. Dineo's parents will be able to visit, and one parent can sleep over with Dineo while she's admitted. If they're feeling sick though, they are asked to please stay away. Other outside visitors are not allowed because of the big risk of infection. Although it is always difficult to predict, Dineo should be in hospital for about 1 month. There is, however, a routine in place to keep the children busy. After having a bath in the mornings, Dineo will be encouraged to eat some breakfast. If she doesn't feel like eating, she'll be given special milkshakes to drink. After breakfast, she will be asked to do some exercises to keep her lungs clear. Too much lying down can cause infection in the lungs. Dineo will have a television in her room and can watch all of her favorite movies and series. She can also build puzzles and color in her books. On days that she's feeling down or if she's tired, it's also okay for her to rest and sleep as much as she needs. Apart from her mom being there, she'll also be visited by other people to make her feel better. Dineo's journey was a success! Although there were days when she felt very sick and very tired, she never felt alone. It's now 6 months post-transplant, and Dineo has come for her follow-up. She has gained back her strength and is very excited to come and greet the nurses and her friends in the ward. The transplant has given her a new chance at life. She can go out and play, and she has a new lifelong friend, Supiwe. She has never been happier in her whole life. I'm always here to guide, always by your side. Bye-bye!